Mississippi, the Element Wealth Studios relocated to the Country Club of Jackson for the Sanderson Farms Championship. Beautiful day, beautiful setting. Come on out, watch these great golfers. You won't see swings like this generally around the course on the weekends. Come on out, watch these guys. They're pretty good, as they say. Joining us now, Guy Giesecke, CEO of Children's of Mississippi. Guy, thanks for coming on.
Okay, thanks for having me.
You bet. So this is not only an incredible event and hosts an incredible golf tournament, but as you are well aware, the PGA and this tournament in general raise a lot of money for charities and good causes across the country. And one of the beneficiaries of that is Children's of Mississippi.
Yeah, we're very thankful and very fortunate to have the support of this tournament and the Serlo agency and everybody that supports us.
Yeah, it's truly awesome. So, how important has it been to you, Guy, that the Sanderson Farms Association and the PGA's interest in donating and raising money for your organization? How important has that been to you?
It's been very important. For instance, we moved into our new patient tower, 350,000 square foot building almost 2 years ago, and we raised $100 million for that.
Yeah.
We could not have moved into that facility. We couldn't have built it without the support of philanthropy. But this tournament and the Sanderson Farms organization was critical to that in terms of the money that they're raising, the money that they give to Friends of Children's Hospital.
Yeah.
It's equal to about $30 million of that $100 million that we raised. So we couldn't have done it without this tournament and without the support of this organization.
Now, Children's is the only dedicated children's hospital in Mississippi. Is that correct?
That's right, and we have a large responsibility to care for all the children in the state, and we have services that they're not going to get in any other hospital. Our goal is to be as good of a children's hospital, not just for Mississippi, but as good of a children's hospital when you compare us to the best children's hospitals in the country, whether they're Houston, Philadelphia, or other places.
Yeah. Well, I will say that I have had the privilege, the honor of completing a tour of the hospital and seeing firsthand. And the people there, that's the first thing you notice, is all the staff, the healthcare professionals. They're awesome. And they're so dedicated, so committed to what they do, and just always have smiles on their faces. And often, let's face it, dealing with very challenging circumstances.
That's right. And we do with everything from primary care, pediatrician visits, to heart transplants.
Yeah.
So we're in everything in between, and that's what makes us different is our doctors, our staff, our facilities. They're all dedicated to children, and that's what their purpose is to serve the children of Mississippi.
Yeah, it truly is awesome, and you've had through the years so many great celebrities and just other figures that have taken a strong interest in the hospital and want to see it do well. They've given their time, they've given their treasure, and many of them are honored, as you know, with photos and framed items and so forth across the hospital, across the facility. It really is the community coming together for a great cause, and that's to help these children get healthy.
That's right, and we are a community resource, and that's the way we look at ourselves, as we're there to serve this state and the communities in the state, and to make a difference in children's lives. And so that's really what our purpose is, our mission, and why our team is so successful.
Yeah. Now, you mentioned just having moved into the new patient towers a couple of years ago, right?
That's right.
Any other projects on the boards?
Yeah, so we
always got them on the boards in the healthcare, right?
We have a very big list.
Yeah.
And there's some that are very much a priority for us. Right now we're about to start construction for a new cancer center.
Okay.
We still need to raise about $1 million for that project, but we're going to get started and hope we do raise $1 million. We're also adding a child and adolescent psych unit to our facility.
Okay.
So those are two of the big projects that we have on the horizon.
Yeah, and I know that there are sometimes they're just very unusual illnesses, unusual diseases that may afflict children, and it's not a lot. But if you don't have the assets locally, the resources locally to care for them, they end up having to travel, and that really puts an enormous burden on the families.
No, it really does. And that's the importance of us serving the whole state, because to have a full-service children's hospital so patients don't have to travel, and then having enough physicians to take care of those patients, you really need about 3 million population.
Wow.
So we have to serve and have to have the whole state support us really to have this level of children's hospital.
Yeah, and I know on the staff there, from a physician perspective, you've got specialists in certain areas, certain practice areas that are fairly rare that take care of children.
That's right, and these are people that go through medical school. They do a pediatric or another kind of residency, and then they'll do 3 or 4 years of extra training just to take care of kids.
Wow!
So it's a strong commitment from these doctors, and so when we have a hospital like this, we have to make sure that we're meeting the needs of those physicians as well.
Yeah, and having toured the facility, it was something that I observed, Guy, was that when you're sick and you're in the hospital, it's already a difficult situation, right? And it's kind of hard to keep your chin up, as they say, and stay positive. But the environment and the facility and the way it's designed and the way it's finished, it really does go a long way towards trying to promote a positive attitude and just a positive view and a positive environment. That's one of the things I noticed. I just want to point out.
No, I appreciate that, and that's part of the value of a children's hospital is we're not just there to take care of the kids. We're there to also take care and support the family.
Good point.
And we have staff that, like our child life workers, that's all they do is help children adapt to the hospital environment, because if they can have a positive attitude then they can go back to school with a more positive attitude. They can get through their illness in a more positive way, and that's really what it's about, is just getting them back on their feet.
Yeah. You know, children shouldn't get sick. It's sad when they do, honestly, and they need to be taken care of and return to being a child. The thing I've always wondered is when you see the smiling faces and the positive attitude of the physicians, the staff, the nurses, etc., how do they do it every day? What drives them? Because I know they're dealing with difficult circumstances, and I know they've got to feel some great sense of victory when someone is cured and released, and it's a happy event, obviously, and you got something done, positive outcome. What drives them? How do they do that every day, honestly?
No, that's a great question, and I think really it's an inner purpose of why they chose pediatrics and pediatric specialty care is because they see it as their job as a bigger purpose than just themselves.
Yeah.
And so when you go to work with that kind of mentality, you see the world in a different way, and that's really the way our physicians and our team looks at things.
And I know that sometimes the children are there for an extended period of time, and the staff, they get attached to them, and the children get attached to them. What's that like sometimes when they depart? It's a happy day, they're cured, and they've taken care of their illness, they get back to normal life, but they're leaving behind friends to a great extent.
No, you're right, and many of the patients and families will come back and see their nurses and their physicians in the hospital. They'll bring us cookies or cakes or different things. We've had people invite our physicians and our staff to their wedding years later, because that, it is especially for some of these chronic conditions like cancer or cystic fibrosis or diabetes or things like that, heart disease. They'll get to be a very personal relationship with their caregivers, and so and our caregivers love them. So it really is a relationship that lasts for years.
Science in terms of health care and medical treatment and curative ability, it's come a long way, hasn't it? And you guys are practicing that at the hospital.
And that's the way we look at things, is we look at, okay, what does the evidence show? What does the research show? And we try to adapt constantly our care to make sure we're practicing at the top of all children's hospitals. Like I said, we look at ourselves compared to the best in the country and the world. And so that's really the way we try to and strive to provide the best medical care at the same time. So whether whether it's the latest drug or a new procedure that we're doing, we really try to look at things from that perspective. So, like for instance, one of the things, we were one of the first places in the country that was replacing pulmonary valves in the heart through the cath lab, as opposed to going into open heart surgery.
Okay.
So we started that last year, and again, we were one of the first places in the world to do that.
So I'm assuming then the recovery and the morbidity from the surgery is far less under that approach than the typical approach.
Absolutely, and the risk to the patient.
Yeah, good point. Good point. Absolutely understand. Appreciate it, Guy. Thanks for coming on, and thanks for all the good work that Children's of Mississippi does, and so glad the tournament is a part of it, and good Mississippians are very charitable, and let's keep it going. Appreciate it.
Thank you, and thank you all for being out here today.
Yes, sir. Guy Giesecke, CEO of Children's of Mississippi, has been our guest on Middays. We'll step aside right here for a break. We're at the Sanderson Farms Championship, the Country Club of Jackson. Come on by and see us.